Okay, good afternoon, ladies and gentlemen. My name is Dr. Kami Chakani. I'm the team lead for RPIW number 3, and we were essentially looking at the OR turnover. One of the key things for us was that trying to understand what it was that made the OR function, and this was what our team did. And it was essentially trying to look at ways in which we will be able to reduce the wait time for the patients. And that's our team, as you can see. And one of the things that we did as part of our background was ascertaining as to what the current situation was. But more importantly, looking at it from the point of view from the patient. So understanding that process flow. And then there were certain things that we did note that were there. In particular, for instance, that we never made our target of surgeries this year. This past year, and for this coming year, we've got an increase of over 750 surgeries to make. The important thing here, and I think I'll go on to the next portion, which does show that what we did understand is that there was a takt time, but there were two sets of takt times. There's this takt time of 2 hours, 10 minutes, which is essentially for the OR for the entire surgery, and there was a second takt time for based on per surgery, and this is now from the view of the patient. So patient flow time, so the time taken of the turnover of around 56 minutes for them to have the OR ready for the patient. And I'll hand it over to Michelle, who's going to describe the rest.
So we have the target progress report sheet. So basically we looked at what our targets were, which was an 18% increase in the surgeries that we'll do this year. And really that's important because that serves your patients, reduces the waiting times to get in for your surgery. But also we looked at the patients in the actual setting and how could we reduce the wait times while they're actually part of the process after arriving at the OR. We decided when we looked at our baselines or looked at what our target was, we set up some measures that we would look at to see, and we put a baseline up of what we were seeing currently when we did our first initial timings, and then where were we going to go, what was our target going to be, and what was it going to look like at the end, so how much of our targets did we realize. So this is our value stream map, and basically what we did for this particular value stream was to look at the lead time for the scrub nurse, the circulating nurses, and also the patient flow. So we can see what time the nurses needed to get everything ready up to the point of the surgeon being able to cut. And we looked at the patient flow from when they arrived in the holding room and how much time was value added. You can see on the right where we've done the percentages of value added time, and then the wait times are the non-value added time. So for our PQA data, Dr. Chikandi covered it a little bit, but we did 5,039 surgeries in last year, and our target was just a bit over that at 5,175. This year's target, when we talked about that 18%, is actually 5,925 surgeries is what we need to realize. So the standard combination worksheet was that we did with surrounding patient flow. Just go back a little bit. Was surrounding patient flow, and so previous to our Kaizen event, we looked at the patient waiting in hold until the time the surgeon could perform their cut, the initial cut, and it was 44 minutes and 5 seconds. Then on the next page, post Kaizen, we took out some wait times by really inputting some standard work, and it went down to 32 minutes, 47 seconds. So in this one here, the percent load bar chart, so we were looking just at the circulating nurse and how many people we need doing that job for during our turnover time. And so this was pre-Kaizen, we needed 1.1 members, which we can't really have, but, and then after the changes that were made and the time that was saved, figured that we could do the same things with one person. One circulating nurse, not one out of all the nurses. Okay. Got me?
Hi there. So my name is Christy. I'm one of the nurses in the operating room. And my participation this week was mostly in helping to define the different roles and responsibilities of each of the nursing staff in the theater. There are 3 staff that we define the roles for. And this is one of the idea sheets, just kind of demonstrating how if we're not working together as a team and getting our duties done in a timely manner, how it can affect the next person, and which creates inefficiencies and time lost. This is just a spaghetti diagram showing the travel of the scrub nurse in a pre-Kaizen. So you can see there's lots of movement within a small area of space. And we did some timings pre-Kaizen as well that helped to identify where some inefficiencies were. So what we did is we created standard work. Standard work for setting up the sterile field, so it's done, you know, in an orderly fashion. And we have a picture of setting up the sterile field and how it should be done for each case. And then we went on to create standard work for each of the 3 members in the OR theater, the 3 nurses, the scrub nurse 1, the scrub nurse, or circulating nurse 1, circulating nurse 2, and the scrub nurse. And what the plan is to do the training schedule and have all of the staff trained in the standard work. So implementation was kind of started this week, although more training needs to be done. And we did some more timings, which kind of showed that there is an improvement. And
that's me. I'm Kim, I'm one of the nurses in the OR, and I wanted to address the problems, well, we all want to address the problems with the OR with too many tables. We used to have the setups for the next day on them, therefore we didn't have, just like you see there, we didn't have room for our setups for that surgery for that day, because we have to try and find tables, and we look for instruments because they're on the next day's cases. So our goal was to make it like that and pick only as needed. So what we started doing now is only picking the first 2 cases. You go ahead. First 2 cases for the next day, starting at noon. That left our instruments already in the sterile storage so that we could have them for the cases needed that day. And then the rest of the cases would now be picked in the following day, in the morning of the 3rd and so on cases. Go ahead. And then we also had problems with missing instruments and the cases not being standardized. So we wanted to standardize the case cards so that we could look at a glance and say, okay, I've got this pack, I've got that, and you could tell what you needed. So we went from kind of messy cases to a standardized format that we could do that. So what we did by that, once we did that actually, you can see our pre-Kaizen data there. We've improved at 72%. We now have stuff that was missing is down to just one thing off and off case. So that's a great improvement. Go ahead. The time that it takes for a nurse to check the cases before they go into the room went down now. An average used to be pre-Kaizen was 4 minutes 20 seconds to now 1 minute and 25 seconds, a 67% improvement. And that's just our post-Kaizen information here. This is our standardized case setup. We took a picture and hung it up in our sterile room, and we have labeled it so that we know what we need to kind of, how we need to follow and set that up. And we made a standard work and implemented it. And go ahead and turn it again. The next one is just our training schedule and the dates that we have to have everybody, want to have everybody trained by. Go ahead. That is how we made use of hallway space. Now that was an old, unused flycatcher that we took down and now made room for a sterile cart. You need to go ahead and turn it. Made room for our sterile cart to be placed right by our sterile storage room where it used to be down the hall because we had no room. Go ahead. And there's Al enjoying the space and loading our carts. And that is an improvement. Now one side is just has carts on it and the other side is clear. And that's all.
My name is Linda Bird, and I'm a member of the senior management team for the Health Division. And I was on the team, and we looked at how environmental services work. And I think all of us throughout the world know environmental services are a very key team member. So we looked in the OR theaters as to how we could avoid some extra walking as well as the waste of movement and time. So the idea sheet shows the environmental services worker going back and forth, peeking in the windows to see when the cases would be ready, and then they weren't able to do their regular work because they were always worried. One environmental services worker told me, I like to be on top of things, so I always want to be watching. So so she didn't have to stay around, you'll see in the spaghetti diagram how many times they go back and forth peeking in the doors. So we implemented a pager system where the scrub nurse would press a button in the operating room, and then the environmental services workers, wherever they were, we hope in the hospital, would hear them and then be able to come to that operating room. They would push it at an opportune time so they wouldn't have to stand outside the room. So we did some time measurements. Okay, so here in this spaghetti diagram, you can see, although it still looks very busy, they were able to move back and forth in the service area. They were cleaning rather than having to go back to the OR. So we did some timings, and we found that in the past, they waited an average of 12 minutes just outside the doors waiting for a case to be ready. And with the summoning button, that was reduced to 3 minutes and 40 seconds.
Hi, I'm Connie Bassaraba. I'm from Environmental Services, and we have this program set up for our staff now. With the circulating nurse will be pressing the button for the pager system, which is situated in each theater. This will help with having the environmental service worker from running and checking if the theater is ready to clean. We have a few technical issues that have been identified, and we will be working on finding solutions to have them resolved. Overall, the idea has helped on time being wasted.
Hi, my name is Marcy Priest, and I'm the patient rep for this group. We did the 5S for the anteroom out of theater 2. Our observations were that the antiseptic supplies were kept in a laundry basket, so whenever the nurses needed something, they had to rummage through the basket to find it. Or the supplies were kept in the cupboard. There was no visual cues or labeling, or it was incorrect or missing. So they didn't know where to find it in the cupboard. And that's the laundry basket. There was also equipment kept on the floor in that room as well. There's some of the equipment that was kept there. And we removed the overstock and not needed items from the cupboards, so we eliminated a little bit of these items in there. Our work consisted of arranging and labeling the cupboards. That's the overstocks. Okay. These are the cupboards that we labeled and put pictures on the outside, so as you walk up to the cupboard, you know exactly where everything is, where to find it. And the supplies in the laundry basket, we requisitioned shelving to put it in bins and labeled, so when they walk out of the OR to get a supply, you know exactly where it is. And also we labeled and put up pictures where the equipment is to be stored. Our score went from 2.3 to 3.5 in that area. It'll be less time spent gathering. This is the parent weight area, and this is what it looked like before we did our 5S. And this is what it looks like after we did it. We moved the sterile water cart away from the area and put up some decals to make it a little bit more friendly. We didn't purchase anything, we just got decals from the RPIW room and placed them on. And that says, oh.
So on day one of our entire team meeting, we did a waste walk on the Gemba in the OR and looked at identify the different types of waste that were there, and you know, started to brainstorm about what we were going to do about that waste. You can see in the second picture that after doing our waste walk and after spending the week together and working on the improvements and getting great ideas from staff, that we were able to go and take from the first picture how it was all covered up. Oh, that's okay. And then we stuck all the things that, that's okay. We stuck everything that we eliminated on the door over there, and so we could realize our accomplishments, because sometimes it just looks like a lot of sticky notes, but when you take almost half of them off, it really looks like you've done something. The newspaper is something that we kept up over the last 4 weeks, and in the first column just shows you our different ideas from the idea summary sheets that we made, that everybody on the team made, that the staff made for us. The staff were great in pitching in and writing down their ideas and even drawing the pictures, which we discovered some artists among us. And then we looked at what can we do to correct these issues that we're having. We have some that are listed as 100, so those are issues we corrected, they're done, we just need to keep up with them. And then we've got some that we weren't able to complete at this point, like when Marcy talked about the stand for the anesthetic supplies. The one you saw in the video was a makeshift one for now, but that one will be finished and installed on Tuesday. So we've set out target dates for those things and some of the trainings and whatnot.
So now that we've heard what each one of the participants has spoken about in terms of it being what we were able to find during the RPIW and things that we did work on, I've tried to essentially try to put down a summary of what it is, and really our Targets Progress Report, which Michelle referred to so eloquently, is that there's some of these items which really do stand out as being really great, and these do contribute to the decreasing the OR turnover time, lead time. Even though this may not sound as something that's directly in it, it has that important impact by affecting how that OR turnover occurs. A simple thing which we have seen, for instance, such as reducing the, if you go to the previous one, sorry. Reducing, say, for instance, the number of aprons. Okay, we stopped up to 500 aprons in one place. Now we've reduced that significantly by 80% down to only having 100, which means that now instead of having to clamber over and get it, we're getting it done in a shorter time. Another thing that we've looked at, for instance, is the walking distance, or the distance that, for instance, the compression supplies, which are used by all the ORs, that has come down from 114 feet that it has to travel. It's now down to 24 feet by simply moving it from being a central place to actually being within the ante-rooms. That is time which is safe, and time that can be utilized for other activities. We've also done the same thing in terms of the lead times, and these are the lead times which we had set a target of 24 minutes, for instance, for the circulatory nurse. Yep, we got down to 28 minutes, but that's great when you go from 48 minutes down to 28 minutes. This allows them that extra time to do more things. In terms also here, when we've done the 5S'ing, our 5S'ing, it has been a great achievement by us being able to at least move from an evaluation score of 2.3 up to 3.5, which is really something. And the one thing which we have worked on is our setup times of moving that from 4 minutes and 20 seconds down to an average of 1 minute and 25, which is really something. In terms of our summary, the workshop summary, these are the 6 things that we feel are the really important and will help us as we move on. Firstly, of course, a decreased wait time for not only the patients, but the patients and where they are in an adequate area. The 5S'ing, that it is still maintained. A key thing, of course, is the communication system, the communication processes, not only with the environmental services team, but also with the surgeons and the anesthetists. And lastly, the movement and placement of the sterile carts down as close as possible to the sterile storage areas. On behalf, and number 3, of course, the standard work for the OR nurses and the case carts. The biggest thing of all is that we want to say thank you, number 1, to the patients who have allowed us to be part of their wonderful experience that they do have at the hands of our surgical team, but also again to the OR team staff themselves, the ones who keep it going, both the anesthetists, the surgeons, and the nurses, and of course environmental services. And of course to our sponsor, Dr. Mudlia, and our process owner, Lesia. Thank you.
I had the honor, I'm from John Black & Associates, and I had the honor to support this great team. And I just wanted to make a few comments. So one of the provincial strategic goals, and also a strategic goal here in Prince Albert, is sooner, safer, smarter surgeries. And I feel that the work that this team did this week really gave us a step closer to that goal. Two things that came to mind for me in watching this work was the interconnectedness that happens and kind of the cascading effect that happens when we start making improvements. So for example, the standard work that was put in place in terms of how the carts are set up. That really helped the flow and how the nurses were coming and how quickly that was for them to be able to check that. But then not only that, but then when they took the carts into the ER, or the OR, they were able to unpack them more efficiently because of the way that those had been standardized. And so there was a linkage there. The same way that we started doing just in time, picking the carts instead of picking the carts for tomorrow, kind of interrupting, not really having flow because the carts were sitting for 24 hours, but really doing it just in time for the surgeries. It cleared up a lot of the clutter, and you heard Kim talk about, it really made the tables accessible for the nurses during the day, and also some of the instruments. But not only did it serve that, but we had been bringing the sterile carts up, and they were being stored across the hall from the decontamination room. So this way, clearing up the clutter by the sterile area, we had room to move, so the carts moved directly right into the sterile storage area. So these all kind of linked together and just really cascaded, and we found that putting one improvement in place led to other improvements. The other thing that I wanted to talk about was the teamwork that I saw this week. So the teamwork in the operating theater as the nurses are setting up is just amazing how they work with each other. It almost looks like a choreographed dance. We did put standard work in place really to help people know who's responsible for what, making sure things don't fall through the cracks. We are not trying to get in the way of the teamwork, but we really needed people to understand, the bottom line, what it is that they're responsible for. The surgeons, after this, starting next week, the surgeons are going to be coming into the room with the patient, so we won't be having that wait time, and they'll be there right away for the first checklist. We're encouraging them to stay in the room and help the team, to help with that teamwork and get us to checklist 2 or the pause 2 a little bit faster. So just seeing that increase in teamwork. If they're not able to stay between the first and second checklist, they're going to have their phones on. And so I'm going to be carrying those with them, so we'll be able to increase the communication again between the team. One issue that came up for us was around patient safety. And so the leadership of this hospital really got right on and addressed some patient safety issues that we saw. And so that's great, and that work will continue. But I really encourage, it's not just the responsibility of the person doing the patient safety, it's the responsibility of all of us. So I encourage you that if you see an area where a patient may be harmed, speak up. Help your colleagues, encourage that teamwork, and help your colleagues to make sure that we keep our patients safe. So this team did a great job with great support on the OR. Did we come up with the perfect solutions? No. but I think we made a lot of progress toward those perfect solutions. And so I challenge the teams now that are left in the OR, as our RPIW team is finished with its work, but the team in the OR that's going to be continuing this work. So I challenge you to, if you find a problem in how this is working, tweak it. Figure out, okay, what do we need to adjust? Don't just go back to the old way of doing things. There's going to take some work in getting, Michelle showed you the 3 value streams. And we really need to get those value streams balanced. And so at the end, everybody is done with their work and we're all ready for first cut. And that we can shorten those times. Because just shortening one of the value streams isn't going to help. Everybody needs to be together. And so again, I challenge you to continue working on that. So I congratulate the team, I congratulate the people working on the OR that were so helpful to us, and our sponsor and our process owner, Lesia, were very involved, came in extra to really understand, made time to answer questions and all of that. So they were a great part of the team. And I think we've taken a big step to making the big hospital, getting our surgery sooner, safer, and smarter. So,